Good morning and welcome to the Wavy Digital Desk. I'm your host, Sarah Good. Today we're going to be discussing the State of Tobacco Control Report. The American Lung Association just released that this morning. So, Virginia received nearly all failing grades in this report. We're going to talk about what that means and talk a little bit about what the suggestions are for the state in the future. I'm going to bring our guests on now. Thank you so much, both of you, for joining us this morning. I know that the report was just released, but thank you so much for hopping on. Um, I think there is a little bit of a back talk. Sorry, we're just making sure we're live on all fronts. So we're live on wavy.com, YouTube, and Facebook now. So if you're joining us on any of those, sites, thank you so much for tuning in this morning. I want to start by introducing you both. So Alex Kasper is Director of Advocacy at the American Lung Association. And then we have Dr. Bobby Mahajan, National Spokesperson for the American Lung Association and Medical Director for the Inova Interventional Pulmonology and Complex Airways Disease Program. So thank you both so much.
I'm happy to be here.
Absolutely. Just to start, and Alex, I don't want to take this one. Can you just tell us a little bit about what this report even is? What is it doing? What's it evaluating?
Sure. So the American Lung Association's State of Tobacco Control Report is a report that we issue every year around this time. This is our 22nd annual report, and it really takes an opportunity to take a step back and look at known and evidence-based tobacco control policies, both at the national level and also, at the state level. And so today we're talking about Virginia. I think those known categories that we talk about in our report are, funding for tobacco prevention and control. So that prevention work typically done by the Department of Health and other community partners. Smoke-free air laws. So, protecting residents of the Commonwealth from exposure to secondhand smoke. We know that there are risks associated with that as well. Tobacco taxes. It's another tax is an evidence-based tool. We know that as we raise tax significantly, we can decrease usage and decrease consumption. Access to cessation services, which I think is really important and something I know Dr. Bobby can talk about. Talk a lot about is when that person is ready to make a quit attempt, that the resources are there for them to support them and to make it as easy as possible. And I think Virginia has made some great strides in that area, and we can talk about that a little bit more. And then flavored tobacco products. Flavored tobacco products, inclusive of menthol cigarettes, is really important because we know that, youth especially are drawn to these products. They've been marketed these products, and we know that, flavors make it easier to start smoking. And especially when you're talking about menthol, and I think Dr. Bobby can address this too, when you're talking about menthol, it makes it harder to quit sometimes.
And I just want to give the grades out, and then we can talk a little bit about what you were saying in terms of the differences in some of these grades and change year to year. But in Virginia, tobacco prevention and control program funding, that received an F score. Tobacco taxes, that received an F score. Smoke free airspace, that received an F score. Access to cessation services, that actually went up to a B from a D score previously. And then flavored tobacco products, that's at an F. It to me, it doesn't seem optimistic, based on those results. And I know a lot of states are sort of following in these categories right now. I guess just to Bobby, I guess just to put this in perspective clinically, are you seeing these issues? Within your patients, are you sort of seeing maybe, is it an increased risk? Is it no decrease at all? I mean, can you explain what you're sort of seeing in your practice?
Yeah, no, I think that's a great question. I think what we run into is that this data really translates not only to what we're seeing with our patients, but how we're trying to address this problem as a big picture. I mean, what we understand and we know very clearly based on decades of data is that tobacco use really leads to the increased incidence of emphysema, development of lung cancer. And so when we see these kind of, I would say, uh, in general, extensive and significant volume of individuals we're seeing with lung cancer and emphysema, we're really failing our citizens because we're not providing these types of services. I mean, these are basic services in the sense of funding to stop tobacco, educating individuals, and even just providing a smoke-free atmosphere. We're far behind, and honestly, over a decade behind where we should be. So do we see this in our patients? We see it a lot, mainly because we are diagnosing lung cancer at a higher rate. We are seeing emphysema more rampantly. And unless we actually put together some kind of action plan and that these grades are showing we're not where we should be, we're going to continue to see those numbers rise. And honestly, unfortunately, we're going to see that patients are diagnosed at these kind of diseases at later stages where we can't help as much.
And in terms of the youth aspect, which you all are talking about on a federal level as well, sort of taking out those flavors, that menthol, I imagine that is going to put a lot of weight on the healthcare system later on from the youth sort of still partaking maybe or having an access point, to take some of these products.
Yeah, I think that from a clinical standpoint, I'm already seeing kids in their late and mid-teens who are vaping, who are using e-cigarettes, and those are typically kind of gateway drugs towards actual tobacco use and cigarette smoking. I think that the incidence of e-cigarettes and vaping has gone up dramatically in the United States, mainly because it's a little bit more socially acceptable for kids. It doesn't have the same kind of smell always. It's a little bit easier to conceal. And although there is that access, and I think Alex can talk to this even more so, not only to vaping and e-cigarettes, but the access to selling cigarettes and the ability for youth to get to them very easily is going to start them early on this road. And the longer you're utilizing these tobacco products, the higher risk you have of eventually developing these diseases such as emphysema and lung cancer. Part of our challenge also is that this kind of report shows that not only are we not focusing on the clinical aspects and informing individuals, but we're also doing a terrible job when it comes to lung cancer screening, which we could do much better. In my perspective, unless we're able to get this at the root, and Alex can talk about this further, selling these tobacco products and making it very easy for youth to accessing it, it's only going to graduate to further tobacco smoking and potentially even other drugs down the road.
And I want to get to something else you said, Bobby, but first I do want to go to Alex about this point about access. And there's a lot of talk within the report, from all the states and federally about taxes for these products, but then also having these licensed retailers that are actually selling these products. Can you talk a little bit about that process?
Absolutely. And so I think, you raised a good question about youth use, and Dr. Bobby talked about it a little bit. The report also reflects that 30% of high school students are vaping daily, right? And so that number is about 15.5% of high school use, tobacco use of all products, tobacco use in Virginia, higher than the national average. And so when we're looking at it, one of the things that we, are talking about is the need for Virginia to have a comprehensive licensing program. So in a lot of states, in most states, there is this process in place for a retailer to have a license so that we have a comprehensive list. We know who's selling these products. Virginia is one of the few states that allows these products to be sold without a license. And so there's no list, for example, for our enforcement to be able to go and check and make sure that these retailers are in fact applying, by the law. And so, from our perspective, from the Lung Association's perspective, a licensing program has to meet best practice. It has to include mandated checks every so often. It has to include graduated fines. So, the first fines, the fines increase as more fines accumulate. And then we ultimately look at, at what point we look at removing a license or suspending a license or revoking a license. And so, that's really important when we're looking at access, because if we don't know where these retailers are, we can't ensure that the laws are being followed.
And in terms of these places, are these smoke shops? Can these just be gas stations? Like, what kind of places are you all working with? Or is it really all of the above, and that's the problem.
It's all of the above, and that's the problem, right? It's all of the above, and that is the large issue. And I think if you think about it in terms of, think about the services that you may get on a regular basis in Virginia, where you eat, where you may get your, um, you know, hair done. All of those services require a license, but we can sell a product that we know is harmful and dangerous, and that retailer is not required to have a license.
Last year in Virginia, the casino opened not too far away from here, just a few miles in Portsmouth. And, smoking in the casino, a workplace, but also a destination, was a big topic. And one thing that you all do mention is some rollbacks in terms of where smoking in the workplace exists. And that is super relevant here in Virginia. And we worry about that secondhand smoke and they even talked about third-hand smoke, actually, and sort of particles bringing home and all this stuff. But I want to just jump because I know that we don't have unlimited time. Bobby, can you talk a little bit about maybe what you see in patients? Are they smokers? Are they having secondhand smoke? Is this an issue that's sort of pervasive in a lot of different environments?
I think that it's a great question because where we are in 2024, the idea of having to worry about whether it be a retail center, a restaurant, a casino, having to be exposed to secondhand smoke really seems archaic to me. People should have the ability to breathe clean air. They should have the right to be able to ensure that their health is not going to be affected by smoking by someone next to them. We see a lot of individuals coming in, not only complaining of chronic lung diseases, asthma, reactive airway diseases, because they live with someone who has a significant smoking history and they're regularly exposed. Now, the best way to deal with that is to obviously talk to the family member or loved one who is in the house. But there's only so much you can do if you have to work in an environment where you can't ask someone to smoke to stop smoking because honestly, in Virginia, it's their right in some places. So I think that when we talk about the idea of not only lung health, but just rights to kind of free air and clean air, Virginia is again falling behind in the times, and I would say even in the decade of making sure that we have clean air available, not only in the home, but in your workplace, because not everyone has the ability to say, well, this is irritating me, it's bothering my breathing, I'm having a significant cough, and they have the ability to quit their job and go somewhere else. So that really should be a right that is inexcusable when a person feels as though they have no choice in those situations.
Thank you. I mean, those are the three top things, at least in terms of the report card that you all released for Virginia. It was, closing the loophole in the Virginia Clean Indoor Air Act to protect more residents from secondhand smoke, requiring tobacco products retailers to obtain a license, and then increasing that cigarette tax by at least $1. Are you all seeing that these are things that are doable? Are you optimistic about these changes going into place? I mean, where do you stand in sort of making these goals happen now for 2024, 1 year later?
I think we're getting there. We're working on it. We're having lots of conversations with partners. We're having lots of conversations with legislative champions around how to address these. Um, whether we address them all in the next year, or a lot of this work that we do is also over a longer term, and some of these changes do take time, and we recognize that. And so some of this is about continued education. I'll highlight in the report the one section where Virginia did really well is in the access to cessation services. And one of the reasons that Virginia did do well there was that they repealed the tobacco surcharge. That was something that we had worked on for a couple of years to get it to the place where it finally passed last year. And so the tobacco surcharge quickly is the ability for insurers to charge someone more for using a tobacco product. Data shows us that these types of penalties don't typically work. And for some people, they actually forego coverage. And so then you have someone who, when they need health services, right, they need to see Dr. Bobby, they need to see, just their regular care, they don't have access. And so last year, Virginia made a great step in removing that and repealing that tobacco surcharge. And that was something that the Lung Association supported. So I think, some of this, yes, is in the shorter term, but some of this is also in the longer.
And Dr. Bobby, with those services, I mean, what do you see do you see the impact of that? Are your patients feeling like they have maybe more resources available, or do you see other doctors, having good interaction and conversation with their, patients about having, the possibility to quit and some of these resources?
Yeah, I think there's been a huge uptick in not only referrals to tobacco cessation programs, but also I think the education around them, that they exist and that they're accessible, has really had an uptick with not only primary care physicians, but also when we do lung cancer screening, we're actually able to tell a patient, look, this is a nearby smoking cessation program. It's not just all about prescribing medications, it's a combination of medications and behavioral therapy. So I think that patients are definitely more optimistic because they truly do look at it appropriately as an addiction as opposed to a choice. So if there is something that can allow them to actually get some support in their treatment, we advocate for it, wholeheartedly. But I think that these kind of steps where we see a significant change just in a year, kind of improvement, we can continue to see that for across the board in the near future. And we have the capabilities of it. We've seen other states be able to do it, especially even in our region. So we just have to be able to have a concerted effort towards making that change.
And I just want to move forward. I know that we're basically out of time. But is there anything that you want first? Maybe this goes to Bobby. I don't know if Alex, this goes to you in terms of advocacy. But what do you want the community to know? Whether that's youth focused or just maybe they have the business, or I mean, what do you want people to know and take away from this report?
I would say that from this report, there's a few things that we can understand. One is that Virginia has to do better, and I think a lot of that comes from education and understanding the risks associated with smoking. I think that the biggest factor we run into is that if you use a cigarette correctly, over time it will kill you. And I think that people see this ingrained in our culture that it's okay to smoke, it's part of what we do. But the more we can educate individuals about the risks of smoking and what the long-term outcomes are, I think the more traction we'll have with kind of improving some of these problems. The best way I look at kind of getting real data and an unbiased view is going to lung.org, which is the website for the American Lung Association, to get your questions answered and actually really see true stats about what we're dealing with, not only in Virginia, but across the country. And I know Alex has, very similar sentiments as well.
Yes, Dr. Bobby said it perfectly. If you're looking for more information on the report, opportunities to get involved, both nationally or locally, visit us at lung.org/SOTC.
Great. And, for anyone watching, the article is up on wavy.com where all of this is linked. So you can go to the full report. You can also see your state's, results, and you can also see what the federal government, needs to do to sort of make changes based on your, your input in the report. So thank you both so much for joining us this morning to talk about this. I'm sure this will be a long-standing conversation that we'll come back to, but great to sort of, take a look at the results and what you all evaluated for this year.
Thank you so much. I appreciate having me.
Absolutely.
Thank you for having us.